Well, thank you so much, Vicky, and that explains why I'm here to receive the money that you are to send to me. But I hope that that can be resolved as quick as possible so that really we can get that sorted out. And now it's time to focus on the situation. We are in Kajiado County. This is one of the counties that we are focusing on, basically looking at the issues that are concerning the region. We are talking about a county that is just about 30 times the size of Nairobi. We understand that it's about 21,000 kilometers square. Compare that to Nairobi, which is about 696 square kilometers. But of course, the population is different because in Nairobi, there are about 3.3 million Kenyans living there. But in Kajiado, they have about 842,000 in terms of population. But of course, the needs are very different, bearing in mind the expansive situation of the county. We are here to talk to the county executive committee member for health, that is Esther. Thank you so much for joining us on Citizen TV, Citizen Weekend. I believe this is your first time.
Yes, thank you.
All right, so let's begin from the start. We're talking about 842,000 Kenyans living in this very expansive county. Of course, the question on very many minds is how do they access their health care? Maybe you can begin by telling us the kind of facilities that you have to take care of these citizens in the region. Of course, borrowing from the story that you had from brokers indicating of some difficulties for the population to access their health services.
Thank you, Sam. We have two aspects of health. We have the prevention and promotive, which is a level 1, and then we have the curative. We have 101 public health facilities. 4 of them are referral facilities. 1 is the main county referral hospital, and we have 3 other sub-county referral hospital. 1 is Loitoktok, Ngong, and Kitengela. We have about 17 health centers. That is the level 3. And we have 82 dispensaries. That is a level 2.
Okay.
Of course, we also have a number of private health facilities, but mostly in the urban settings. It's also important to mention that, yes, Kajiado is expansive. We have both extremes. We have the urban, that is the Kitengela, the 126 route, that is Kiserian, Ngong, Rongai. And then we have the other part, which is extremely rural, extremely marginalized,
right.
I may say. Yeah, so that is the...
And so as you say, these people, the areas that is very expansive, the rural regions, these are still Kenyans within Kajiado County that deserve to be served despite their pastoral nature, their nomadic nature. So how are you ensuring that whatever services a person who is living in Kitengela, the Kenyan who is, let's say, in Loitoktok, the rural part of Loitoktok, they're able to access the same services and quality?
What we are doing in health, we are working to expand our services. We have upgraded most of our facilities to be able to offer more comprehensive services. We've also worked to ensure to improve our referral system by having ambulances. Initially, our ambulances were only found in the main county referral facilities. Now we have land cruiser ambulances that can, access the very rural facilities. And we also do outreaches in places where we don't have health centers, to be able to, to reach out to those who are not anywhere near the facilities that we have in the rural areas. And how effective is that? We have 2 tracks now. We have the Beyond Zero, the First Lady Initiative, and then we have one that we got as a donation from the Korean government. And we also do, screening for things like TB in their natural settings in the markets. in water points sometimes, things like HIV testing, TB screening, and So we work to take the services to the people in places where we don't have health facilities.
Right.
Yes.
I'm looking at your health budget, and from some report I found is that you have a budget of 8.2 billion shillings in the county, the county government. Of course, 6 billion shillings is coming from the national government. And then again, out of all that, 2.4 billion shillings is going to health services. But for the manpower, the salaries that you have to pay, the salaries and wages, it's 1.3 billion shillings. So that leaves so little to really invest in expanding your facilities and equipping them. So how do you see you have some 3 years to the just about 3 years and about 10 months to the expiry of the current term. So how do you ensure that with all these facilities that are not properly equipped and with the limited resources, how do you ensure that the Kenyans in Kajiado are accessing these health facilities?
Thank you. One is, yes, it's true that most of our, over 50% of our budget is goes to human resource. Another 25% actually goes to medicines and other non-pharmaceuticals. So we actually have very little for infrastructure.
Right.
But we work with partners to support that aspect. But the biggest challenge we actually had as a county is that the first county integrated development plan was not as consultative, so it did not really respond to the priorities that we had then as a county. The new CIDP, we had the involvement of the department and other health stakeholders, so the gaps are clear, and we are engaging our partners and well-wishers to support the infrastructure development. And of course, we also partnering with the national government. We have a facility like in Ngong that we are working in partnership with the national government. But mostly, we have also improved on the governance of our county health facilities.
Right.
We have got professionals on board to help in the management, not just in the management of the facilities, but also to help us in mobilizing and reaching out to well-wishers to support the development of our county facilities.
Okay, I want to focus on something that is a national pandemic, that is the HIV and AIDS. And looking at the statistics, we see that 4.7% of the population in Kajiado is infected with HIV and AIDS. That is the prevalence rate. Of course, it's slightly lower than the national average. But how, as a county, how important is HIV and AIDS prevalence, and how to tackle it from the plans that you have in the health sector?
We have established more testing sites. I just mentioned earlier that we try as much as we can to take the services very closer to the people. We also encouraging the men to test. Of course, we know more women the people who know their status, not just in Kajiado, but in the whole country, is that we have more women knowing their status. But what we are doing, we have established more testing sites. We are taking that service closer to the people, because out of the 4.7%, about 24,000 people in Kajiado an estimated are infected, but only 10,000 of them are on ART treatment, and we are working to reach out to more to have them start treatment as early as they should be.
Okay.
Yeah.
I'll shortly be taking some 2 questions from the audience that is here, but before you do that, you're talking of partnership a lot, and looking at specifically the HIV and AIDS situation in Kajiado County, I see that in the year 2016-17 financial year, of how much was used going towards that HIV and AIDS, we had 287 million shillings by NGOs, and for the government, the county government of Kajiado, there was a contribution of 16.5 million shillings only. So 60 million versus 287 million that has been spent by NGOs. Do you still think that it is an important factor that you're focusing on in Kajiado? Do these resources reflect that?
Of course, I think, the most of our county budget goes to human resource support,
Right.
and some of those staff actually are working in HIV in HIV clinics, and the investment by partners is also captured in our plan, and the investment that partners are putting in the HIV sector is actually something that the county actually reached out to most of these partners because of the gaps we had in our budget. We have the USAID Afya Plus supporting most of our HIV clinics, including the salaries for the workers in the HIV sites. But we also have a lot of resources for HIV being managed from the national government. So it might not reflect in our county budget because we have the National AIDS Control Council, which is also funded by the Kenyan public, and that has structures and works with the county governments to support HIV prevention. We also have the National AIDS Control and STI Control Program, which is a government institution that is funded by the Kenyan public and has structures to work with the county. So the county budget might look like we are not really investing in HIV, but it's because part of the HIV budget is actually managed from the national government. So we have programs that we are working with national government, but which is also still an investment from the public. So in the county budget, it might look very small, but we still have the national government, most of the HIV budget going to the national institution.
All right, I'll not push that further, but let's hear to listen to one of the questions. Maybe you can tell us your name, utuambie jina lako na swali ambalo ungependa kuuliza, na pia utuambie umetoka wapi.
Asante sana. Kwa majina naitwa Daniel Ketukei. Asante sana Sami pamoja na Esther Somoire. Swali langu ni alafu pia natoka sehemu ya Amboseli, especially mahali naitwa Ngong Narok. Na swali langu ni kwamba referral hospital yenye tuko nayo hapa kama wakazi wa hii area iko mbali sana. So iko mbali sana na community, na kuna uwezekano gani hiyo referral hospital iweze kukaribia at least ndio watu waweze kusaidika kwa sababu iko mbali sana. Asante sana.
I think he's referring to the situation that as a county, your referral facility is Kajiado County Referral Hospital.
Yes.
That is for the extreme cases. Yet they are here in Loitoktok. They have to travel 5 hours to that referral system. What is the solution?
Actually, the referral facility that he's referring to is Loitoktok, because Loitoktok is a sub-county hospital, and we are working to upgrade even the health centers that are closer to them. I think the closest is we've just actually we will be officially opening Meshanani, which is just within the Amboseli Game Reserve.
Right.
Then we have 2 other facilities within this locality. But what we are doing, we are expanding the services that we are offering in these rural facilities, so that they don't have to go to the referral facility to access these services. And in cases where we need referral, to refer patients to the referral, and that is either Loitoktok or Kajiado for this locality, is that we have now acquired ambulances that can actually offer that service of transferring the patients from these facilities within the Amboseli or within his locality to the referral facility.
Okay.
Yes, so we are upgrading the local and the rural facilities to be able to offer the services offered at the referral facility.
Okay, we now want to take another question from part of the audience. Na kwanza, unapotujibu swali lako unaweza kutuambia kama unafahamu kwamba kuna ambulances katika kaunti ya Kajiado, kama umeweza kuzitumia, kisha uweze kumuuliza swali lako.
Okay, jina langu ni Miriam Daniel. Hata mimi niko kutoka Amboseli. Ambulance moja tuko nayo iko mbali kidogo huko juu, mahali karibu na Loitoktok. Alafu hapa tuko na shida ya wamama wakijifungua, wanaweza jifungua usiku, hatupati usafiri maana gari iko mbali na kuna wanyama, kwa hivyo hatuwezi toka kwenda na miguu.
So how utawasaidia vipi kina mama ambao ni wajawazito wanataka kupata huduma za matibabu haya lakini wanahisi kwamba hizo dispensaries hata kama ziko mbali?
Nimesema tu a few minutes ago kwamba tumekuwa tukijaribu kuexpand na kujenga mahospitali karibu kwa kila village ama kwa kila mahali kila mtu anaweza access hiyo service ama kupata hospitali kwa karibu. Lakini of course hii ni safari, tumeanza tu na katika hii locality tumefungua hospitali kadhaa, na zile ambazo tulizipata tumejaribu ku upgrade pia. Na karibu hospitali zetu zote zinaweza kupeana huduma ya delivery. Karibu zote ziko na delivery coaches, ile ambayo mama anaweza kujifungulia, na wale staff wako pale wako trained kuweza kusaidia kina mama ambao wanaweza kujifungua. Right. Ninajua hiyo ambulance anasema iko mbali kwa sababu iko Murutot, lakini hapo ndio tumeanzia kwa sasa. Tukianza hii ago hakukuwa na ambulance ambayo ina serve area. So hiyo imekuja kama relief, na tunaendelea the coming year bado tunafanya kazi na partners wetu tuweze kupata ambulances zingine zaidi, tuweze kuwa na at least ambulance moja kwa kila ward ama mbili, na zile ambazo pia ziko kwa sub county facilities. Right. Zinaweza pia kutumika kuja mashinani kuchukua wagonjwa na kupeleka kwenye ile referral facility.
All right, and I hope that becomes successful so that we don't have such questions with devolution now on its 6th year, or almost 7th.
Yes.
And lastly, the final question I want to ask you is about the managed equipment service that is in the country. We had a story earlier on of counties, senators have been complaining, and of course now we hear from the KMPDU. They are saying that this is a scandal. I don't know whether it's working for you. Have you been prompt in submitting or paying the fees that you need to pay for this equipment, and how have you been using this equipment since they were released to your county?
Okay, most of the MES equipment in Kajiado are working, although there are some we found, when we came in last year, the renal unit equipment were actually somewhere locked up in a room and were not being used. So we trained the personnel that we needed to train, and we were able to commission it earlier this year. Most of them are actually working, the ones that are in Kajiado. The challenge, of course, we have had as the CECs for health are the same issues that were raised by the senators, but or the governors. But the biggest challenge I would say for now is that all counties are paying the same amount of money. We have been paying 97 million every year. I think now it's gone to 200 million. But unfortunately, there is unfair distribution. It's not the same for all counties. You find a county that has received almost every other equipment that has been procured by MES, and there's another county that has only probably received one or two.
So for you just received renal unit equipment?
We have renal unit, we have theater equipment, and we have a few ultrasounds for Loitoktok and Kajiado sub-county. But you'll find there's a county that has received that, has received an ICU, has received a CT scan, has received,
so
almost every other.
How much do you think you should be paying for what you received?
You
don't know?
Honestly, yeah.
Okay, all right. Esther Somoire, the County Executive Committee member for Health in Kajiado County, thank you so much for making time for us. And that's it. That's the end of Citizen Weekend tonight from Amboseli Serena Safari Lodge here in Loitoktok, Kajiado County. Of course, tomorrow this program continues, the special coverage of Kajiado County. You will be listening to the governor of Kajiado, that is John Joseph Olelenku, and Victoria Rubadiri will be talking to him. Of course, that's why she left studio early so that she is now on her way to Kajiado to come here. Then I can leave and go back to Nairobi. So she'll be here with the governor. And stay tuned to Citizen TV. Thank you for watching. My name is Sam Gituku, and bye for now. Good night.